Hi, I'm Dr. Daniel DeSimone. I'm a consultant in infectious disease at the Mayo Clinic in Rochester, Minnesota. I'm an associate professor of medicine, and I am vice chair and senior author of this statement.
Hi, I'm Dr. Larry Baddour. I'm Professor Emeritus of Medicine at Mayo Clinic, Rochester. I was honored to chair our scientific statement entitled The Update of Cardiovascular Implantable Electronic Device Infections and Their Prevention, Diagnosis, and Management. Dan, you want to talk about diagnosis?
Absolutely. This part here is very interesting. In other words, how do patients with cardiovascular implantable electronic device infections present? There are several ways they may present, and some are quite obvious. And on physical exam, you can make that finding with a device that's eroding through the patient's chest at the pocket site generator. The patient may have significant erythema, swelling at the pocket site. Where it gets more challenging are in these difficult cases where the patient has absolutely no physical signs or symptoms of a device infection, and they may just simply present with a bloodstream infection. So they may have fevers, chills, that blood cultures are obtained, and they're positive for a specific organism. And I think the biggest thing I want to point out here is in CIED infections, we want to remove devices completely if they're infected. And if they're not infected, we want to keep the device in place. Now, that seems pretty straightforward and obvious, but that's the biggest question here. And especially when we get back to those cases where there's no obvious signs of infection, we have to start relying on these diagnostic tests like transesophageal echocardiogram, PET scan, and other findings to try to increase our sensitivity as well as specificity. Because the last thing I want to do is take out a device that was not infected, as that puts the patient at risk for significant morbidity as well as mortality from the procedure itself, significant financial cost burden on the healthcare system.
So we want to remove infected devices, as Dan mentioned. At the same time, we don't want to remove devices that don't need to be removed. So if the device is not infected and yet the patient has some type of bloodstream infection, it's a difficult decision many times. I think the requirement is that you have a multispecialty team managing these very complex patients and making a group decision as to what should be done for these difficult patients. Now, 60+% of the patients with CIED infection will have pocket site infection. But when you're dealing with a bloodstream infection and a negative pocket site, that really requires some scrutiny, more diagnostic procedures than what might be normally required.